Alright guys, what's happening out there? We'll be live there now shortly. Proper live. Small couple of issues here at the moment. You might have seen a stream there testing things out a little bit ago. Yeah, we're able to get the stream up and live, but now it seems like the TV is blinking on and off. Mighty crack. Committee meeting kicking off in a couple of minutes. Is the video player up there ready for it? No, still no video player up there for it yet. So this transition might be easier than I thought. Happy days. Seems like the power cables are the same on both. Seems like, but no, my luck the last while I'll plug this thing in now and the TV will blow up. There we go, wish me luck. Right, there's one. We got life. Yes. The screen is a little bit smaller, so everything looks a bit more smushed up. But, look. Happy fucking days. Gratitude. Thank effing that I had a spare a little monitor lying around. Alright, where are we at? Is the video player up for this thing yet? Nah, boy. Shannon there and live. Feckers have me worried now. Probably not the only one with technical issues. Not surprised with the government, to be fair. Like, credit where it's due. Like, we've not had any issues with. Hey, there we go. Look, and it's on time. Fair effing F's to him. 1 second now. There we go, the ball is rolling. Jeez. If only if the government itself was as efficient as the streams they do on Oireachtas TV, because, you know, credit where it's due, they do well. They do well. Oh, there we go. Where am I? Oh. Hey, howdy ho. I am here. That's strange. Oh, wait. Oh, yeah, this is locked. Boom. Ah, that's what's up. That's what's up. It just happened to coincidentally be like perfectly in line with this white box. For some reason I thought it was like hiding me. We fixed that. There we go. That's better. Turn the camera a bit that way. Boom. Gorgeous. Save. Looking at even fixed real time over there on the other one. Amazing. Alright, who's out there in the hot box anyway? Spliff 420, what's happening, Spliff? We're just waiting for this to kick off, so howdy. Boom. Anybody into coconut water? I know the green screen ain't going to do this stuff any justice, but pure young coconut water by Nature's Charm. White on top, kind of green in the middle, and yellow on the bottle is the colour of the can. And it's not one of those feckin' recycling cans either. You can just stick it into your normal recycling at home, coming straight at you from Thailand. So there you go, keep an eye out for this one. I hope I didn't just rat on him over being fucking not that recycling thingy. Some pain in the arse walking all the ways over there to recycle your cans and your bottles to get back your own money. Fecker's holding your ransom. Oh yeah, there was that. Oh. Ooh. Beautiful. Probably the best way to deal with cotton mouth. Alright, I know I said credit where it's due. But come on, whoever's like in charge of timekeeping up there. Inefficiency of them already kicking in. Techies, do you know what I mean? The techies have been held to account for the quality of their work. That's what the thing is. Do you know, if you feck up the stream starting it, like, you're in trouble. But like, if you're the chair that got hair luck, there's nothing about, like, you know, timekeeping there. Government never held to account. Well, damn, you seem to be getting a lot of feedback out there, are you? Oh. Yeah. There we go. Oh, that seems a bit better, does it? That sounds a lot better there now, at least to me. Just turn up my headphone a bit. Boom, boom, boom. Ooh. Guys, apologies about messing around with these technical issues. It's a ball since not been doing regular streams, the 420 news and what have you. A little bit of time away there as well from the studio over the Christmas break with no meetings going on. Should have made it my effort to get out here and do a bit of a stream for the 420 news. There was a lot of content that could have actually been covered over that period of time. One piece of news that I hope isn't an issue in sharing, but there will be another series of podcasts coming out by the social grassroots social
we have
club.
Deputy Moore, apologies from Deputy Moore Devoyne and Senator Lynn Rowan.
Let's go with this.
Deputy Amurku will be stepping in at some point for Deputy Devoyne. I'm delighted to open the 12th public meeting of the Joint Committee. Today we'll be discussing the rising use and dangers of nitrous oxides and other inhalants. We're joined today by witnesses From the Health Research Board, Dr. Suzi Lyons, Head of the National Health Information Systems with responsibility for the National Drug-Related Deaths Index and the National Drug Treatment Reporting System, and Dr. Deirdre Mongan, Research Officer with responsibility for the National Drug Strategy and Early Warning Systems for Drugs. From the Health Service Executive, Professor Bobby Smith, Consultant Child and Adolescent Psychiatrist with Adolescent Addiction Service, Mr. Joe Doyle, National Lead for the Social Inclusion Services, and Ms. Mary O'Kelly, Integrated Healthcare Area Manager. And on behalf of the committee, I also wish to extend the warmest welcome to Dermot Maguire and Yvonne Maguire, who are attending today's meeting in a personal capacity. Yvonne and Dermot are the parents of Daniel Maguire, a 14-year-old boy from Huntstown, who died tragically in 2025 following the inhalation of aerosol deodorant. We are enormously grateful for you coming in today and providing your testimony to the committee. We'll all benefit from it massively. So just a note on privilege before we begin. All witnesses and members are reminded of the long-standing parliamentary practice that you should not criticise or make charges against any person or entity by name or in such a way as to make him or her identifiable or otherwise engage in speech that might be regarded as damaging to the good name of the person or entity. Therefore, if your statements are potentially defamatory in relation to an identifiable person or entity, you'll be directed to discontinue your remarks. It is imperative that you comply with any such direction. I'd also like to remind members of the constitutional requirement that in order to participate in public meetings, members must be physically present within the confines of Leinster House complex. Members of the committee attending remotely must do so from within the precincts of Leinster House. This is due to the constitutional requirement that in order to participate in public meetings, members must be physically present within the confines of the place where Parliament is chosen to sit. In this regard, I would ask any member partaking via Microsoft Teams that prior to making their contribution to the meeting that you confirm that you are on the grounds of the Leinster House campus. All opening statements have been circulated to members and will be published on the Oireachtas website after the meeting. As agreed, we'll limit each opening statement to 5 minutes to allow plenty of time for questions. I'm conscious of a wide range of issues to be discussed today. If necessary, further and more detailed information can be sent to the clerk for circulation to members. For our witnesses, I should also mention that due to other parliamentary commitments, members will be in and out of the committee room during the meetings due to the other commitments that you have to attend to, so please don't take notice of that. For our opening statements, I'd like to ask Dermot and Yvonne if you wish to go first and give your statement.
First off, thank you, Gary, and thank you to the committee for allowing us the opportunity to share our son Daniel's story. It's not easy. Daniel was a marvellous young man, a beautiful young boy. He had the personality, he loved the gym, he had a huge group of friends, real fit, real healthy. He's the middle son of 3 boys. He was the best friend to Andrew, who was only 17 months younger. He idolised his older brother Adam, 24 years old. He's a huge loss, not only to the family but to the community as well, to his school, etc. On the night of the 26th of September, almost 4 months ago, I was locking up and I called up to Daniel and says, "Daniel, have you got the key at the front door?" He said, "Yes, Dad." I said, "Will you throw it down?" He says, "Yes, Dad." They were his last words. A couple of seconds later, "Daniel, are you throwing down the key?" No answer. So I was up the stairs. I was on him in 30 seconds. I went into his room. He's passed out on the floor. Myself and Adam worked on him, CPR. The emergency services arrived. They worked on him. They took him to Temple Street. All in all, I think he was worked on for about 2 hours. But I knew when they took him out that door, he was already gone. He passed out. He never woke up. I don't think Daniel even knew he died. Okay, he fainted, and that was it. And for a simple thing, deodorant. That was it. Okay, I do have one here with me. I won't show the brand, but the generic deodorant. This is what killed my son. It's in everybody's home. It's free. It's free for kids. They don't have to go looking online or meet somebody down back alleys. This is free in anybody's home. Okay, so you may notice the warnings on these. The one that stands out, it's flammable. That's the only warning on this that stands out. There is a warning on it. It's even for me looking at it here, even though I know where it is. In the right-hand corner, this one here, solvent abuse and kill instantly. That's it. That's the only warning on these things. After Daniel died, the community support that we received was amazing, from Paul, his wife Angela, etc. From the teachers in the school, they came to us and said, do you want us to say why Daniel died? And we said, yes, tell them everything. We need the kids to know. And the kids knew straight away. Feedback from the schools has been very positive. We've had reports back of kids that have gone to teachers and said, we were doing it, we have now stopped because of Daniel. We put out a video that went worldwide, over 10 million views. There was articles in Argentina's media, Australia's media. This thing actually went worldwide. It blew us away, the traction it gained. And we got messages from all around the world. This is not an Irish problem. This is a worldwide problem. We have lost our son, we've lost our daughter, we've lost parents. It's adults as well, it's not just kids. So we got these messages from all over the world, but mainly from around Ireland. And I found out with a lot of them from Ireland was we never went public with it. Okay, and that was the thing. They never went public, and that was it. Basically, if a child does this and inhales deodorant, one of three things is going to happen. The first thing is nothing. They're going to pass out or whatever. They're going to wake up. They're going to go home. Nobody's any the wiser. The second thing is cardiac arrest. They're going to drop on the spot. The third thing is, and what happened to Daniel, a blood clot in the lung, cuts off supply to the brain, oxygen supply to the brain. You pass out, you don't wake up. You know, that's when the kids do this, they're rolling a dice, and they're going to get one of these three options. Sorry, excuse me. What we'd like to see going forward is obviously warning labels on deodorants made bigger, more prominent. We are currently in the process of contacting all the major retailers in Ireland to request the ban on sales of aerosols to under 16. Okay, so that's obviously something that we're only in the process of it at the moment. We're hoping for a positive response from the likes of Tesco's, Musgraves, Aldi, Lidl's, stuff like that. Our main point with Daniel is education. I mean, like, kids need to be educated on this. They need to be educated. We are aware that teachers are not provided training in aerosol abuse. They are provided training in other drugs and stuff like that, but in aerosol abuse is left out of their training. This needs to be brought in. We've been in touch with the Minister for Health and the Minister for Education about these also, and we've got some very positive responses. So yeah, going forward, you know, better warnings, restricted sales, you know, education. That's the main thing for us, is education. But I'll just finish with saying our children are dying. It needs to stop. Thank you.
I mean, thank you so much for giving your contribution. I have no idea where you're getting the strength, but we are really grateful for you coming for us today. Thank you, Yvonne. From the Health Research Board, Dr. Suzi Lyons or Deirdre Mongan to give your contribution.
Yes, Deirdre, thank you very much. And before I start, I just want to extend my sincere condolences to the Maguire family after Daniel's timely death. Before I start my statement, I just want to state as the role of the HRB, the Health Research Board. We're the lead agency for generating and disseminating evidence on drug and alcohol issues. And throughout the statement, when I talk about numbers and cases and statistics, I think it's important to acknowledge there's people behind all of these numbers. So I'll start now with my statement. So inhalants are volatile substances that produce chemical vapours or gases that can be inhaled to produce a psychoactive effect. Examples include gases, glue, correction fluids, petroleum products and aerosols. Nitrous oxide, also known as laughing gas or hippie crack, is a colourless gas that has a number of legitimate medical and industrial uses. For example, medically as an anaesthetic and commercially as froth, to froth or as a propellant for food items. While it has been used recreational for its brief euphoric effects for over 200 years, in the last decade the international literature has reported an increase in its recreational use and an increase in reported health harms. Its popularity has been attributed to the fact that it is cheap, readily available and undetectable on routine drug screening. At present, nitrous oxide is not a controlled substance under the Misuse of Drugs Act 1977. It can be legally sold for catering and industrial purposes. There were limited data on either inhalant or nitrous oxide use among adults in Ireland. The only source of data on adult nitrous oxide is the European Web Survey on Drugs, an online survey of adults aged 18 and over who use illicit drugs. In 2024, among Irish respondents, 5.3% had used nitrous oxide in the previous year, and this increased to 9.2% among younger adults aged 18 to 24. SPAD is a survey conducted among 15 to 16-year-old school children across Europe, including Ireland. In the most recent survey in 2024, 6.3% of Irish school children had ever used inhalants, almost identical to the European average of 6.4%. The survey also reported that in Ireland, inhalants were the third most commonly used substance after alcohol and cannabis. Inhalant use decreased since the 2019 survey, when 10% reported their use. In 2024, SPAD included questions on nitrous oxide for the first time. 2.1% of Irish school children had used nitrous oxide, 3.4% of boys, and 0.6% of girls. So what are the health harms associated with inhalants and nitrous oxide? Short-term adverse effects of inhalants include hallucinations, confusion, nausea, and loss of coordination. Long-term effects can include damage to the brain, liver, and kidneys. Inhalant use may lead to death from asphyxiation or suffocation. The range of adverse health harms related to nitrous oxide is yet to be fully elucidated. Frostbite injuries due to nitrous oxide have been reported. Nitrous oxide-induced myeloneuropathy is an umbrella term for the neurological harm caused by vitamin B12 deficiency arising from nitrous oxide use. The most common presenting symptom is tingling or numbness, primarily in the lower limbs, with other symptoms including gait disturbance, ataxia, and bladder and bowel dysfunction. Nitrous oxide can trigger psychological symptoms and primary psychiatric presentations, including delusions, hallucinations, paranoia, depression, or acute psychosis. So I'll move on to the health harms reported in Ireland. So there are no national data on the extent of nitrous oxide or inhalant hospitalisations. However, there are a number of case reports. Between October 2022 and July 2024, 18 patients presented to Tala University Hospital with nitrous oxide-associated myeloneuropathy. From September 2022 to March 2023, 7 frostbite injuries due to recreational nitrous oxide were managed by adult and paediatric burn services in Ireland. So, treatment. The NDTRS is a national register of addiction treatment in Ireland. Since 2021, there has been a year-on-year increase in the number of cases entering treatment for volatile inhalants, including nitrous oxide. In 2021, 28 cases entered treatment reporting use of volatile inhalants. This increased to 108 cases in 2024. The number of nitrous oxide cases was 0 in 2021 and increased to 54 in 2024. Among cases entering treatment for nitrous oxide in 2024, 22% were aged 14 or under, 35% were 15 to 17 years, and 43% were aged 18 or over. The NPRID system recorded 69 admissions due to the misuse of inhalants in 2024, an increase from less than 5 in 2020. Finally, I move on to mortality. The National Drug-Related Deaths Index, the NDRDI, records and reports on drug poisoning deaths in Ireland. The main source of NDRDI data is closed coroner death investigation files. The latest NDRDI data on drug poisoning deaths is 2022. Between 2020 and 2022, the NDRDI recorded fewer than 5 deaths where volatile inhalants were implicated. No death had nitrous oxide implicated. Internationally, data shows that deaths involving nitrous oxide are rare, and in most cases, the cause is accidental asphyxiation. Thank you.
Dr. Mongan, thank you so much for your contribution. From the Health Services Executive, Professor Smith.
Okay, thank you. Again, before I start, just to acknowledge the bravery and willingness of the Maguire family in being vocal about this particular issue. Starting the formal statement, though, good morning, Chairman, members. Thank you for the invitation to meet with the Joint Committee on Drugs to discuss these issues. I am joined by my colleagues, Mrs Mary O'Kelly, Integrated Healthcare Area Manager for Kildare and West Wicklow at HSE Dublin and Midlands, and Mr Joe Doyle, National Lead with HSE Social Inclusion, Access and Integration. Today we'll highlight the emerging trends relating to nitrous oxide and inhalants, and we'll also outline a number of the actions undertaken by the HSE in response to these trends. The Irish landscape has significantly changed, seems to be ever evolving, with use now occurring across all strands of society. While historically attention focused primarily on certain at-risk populations and people who had high levels of risk factors that seemed associated with drug use, the current situation is certainly more complex than this sort of view of the past. Young people navigating a very different social context. As a result, it's harder to predict what young person will use and be at risk of harm across our society. And this is a concern for all of us, whether we're wearing our hats as healthcare providers, as I am today, or whether we're thinking as parents. Despite these new concerns, the evidence base remains consistent in guiding how we should prevent and respond to new trends. An effective drug prevention system requires coordination, collaboration across sectors at national and local levels. Drug prevention activities not only include structured programmes specifically focusing on drug use, but also wider activities that aim to support positive health and social well-being, and I suppose promote the protective factors that seem to be associated with reduced likelihood of problems in this area. We're aware that the committee has previously discussed drug prevention and received presentations from HSE Health and Wellbeing before Christmas. Today we'll outline the available information on the emergence of nitrous oxide and inhalants and the recommended best practice response for these trends. As an immediate response to nitrous oxide, the HSE undertook a number of specific actions a number of years ago, such as adding nitrous oxide specifically to the information on the drugs.ie website, and collaborating also with both regional and local drug and alcohol task forces, who each have a prevention and education committee to develop educational webinars for frontline services and to support local communities where concerns were initially arising. To inform the public, the wider public, the HSE developed information fact sheets for those who use nitrous oxide and for parents to inform them about this drug and give guidance on how to discuss its use and risks with their teenagers. Between the period 2023 and 2025, over 8,000 people engaged with the nitrous oxide content on the drugs.ie website. The HSE is currently in the process of redeveloping drugs.ie, and the new website will hopefully launch early this year. This will offer an improved site which we anticipate will increase engagement with the public, including more among parents, young people and among people who use drugs. The topic of nitrous oxide is a common feature on our drugs.ie social media channels to help create awareness. One thing to keep in mind is the fact that communication of information about substances, including nitrous oxide and inhalants, to adolescents does require careful consideration. Large-scale campaigns relating to drugs can have unintended consequences, and there's a risk that they could inadvertently increase interest in and use of substances by creating, knowledge or interest that wasn't there before the campaign. In line with best practice, and in addition to school-based prevention strategies, the pillar intervention of which in Ireland is the Know the Score programme, a number of areas are recommended as suitable responses to emergence of nitrous oxide, such as through youth and outreach projects, training professionals and support for parents. Through strengthening their knowledge. These approaches can be adapted to any new trends which present, including the use of inhalants. The Parents Matter webinar series was developed in 2023 by the HSE to target specifically parents to deliver education and prevention initiatives within their own home. The series involves updates on emerging trends, youth development, guidance on prevention strategies and signposting towards support services. The last webinar in October 2025 had over close to 3,500 parents registered, and over 1,500 actually attended the live event. The core principles of prevention from these webinars can be applied in response again to any drug or substance which presents. As we approach the new National Drug Strategy, prevention and education should be prioritised to build the sustainable national infrastructure for drug prevention, which requires resourcing, training, staff support, research and evaluation, of course, to make sure that what we're doing is actually effective. Other prevention and early intervention tools, such as the HSE's SARE screening and brief intervention programme, can be further promoted in relevant sectors such as youth education and training spaces and primary healthcare settings, including hospital emergency departments. Prevention works best when it begins early, is sustained and is supported by the whole community within schools, families, services and policy systems work in collaboration. The HSE is committed to continuing to collaborate with its partners over the coming months and years to achieve this. Emerging trends require a whole system approach to identify, monitor and determine suitable responses. We anticipate that new drugs will continue to present public health challenges in the years ahead. Future drug policies need to reflect and be adaptable and nimble to this reality to respond to these trends to ensure rapid responses when public health challenges emerge. Thank you.
Thank you, Professor Smith. We'll now move on to questions from our members. A rota was circulated in advance. Members have 7 minutes for questions and answers. And Deputy Brabazon, you are up first.
I suppose, first of all, at the outset, I want to thank you, Yvonne and Dermot Maguire, for their testimony here today. It's been extremely moving. I saw your presentation, I think it was on prime time in recent weeks, and it was one of the most moving things I've ever witnessed. I can't imagine what you've gone through, and I want to commend you for what somebody else described here as your bravery. I'd say the easiest thing in the world would be to roll up on a ball in the circumstances, but you've come out and you really want to make a difference in this whole sphere, and I commend you very, very strongly for that. Just to ask in relation to, so I suppose, look, what you've been through puts, it makes me feel really the heavy burden of being a legislator, and you've highlighted the actions that are required in terms of labelling and in terms of information, in terms of education, and that's something I certainly know myself and other members will certainly be very cognizant of, and will strive to work on. And I know in our reports we'll certainly recommend all of those things going forward. And I think there's an urgency about it as well. I don't think we can really wait around for that. We don't want any other parents going through what you've been through. Just in relation to, if I can ask the others, just in relation to the nitrous oxide, there seems to be a widespread use of it. I know myself, as a member of one of the local Tidy Towns groups, we go out litter picking on a regular basis and we find boxes of empty canisters. And we don't know yet, am I right in saying that we don't know yet the long-term implications of long-term use of nitrous oxide? Is something like, vapes are a recent thing, and we don't have a lot of information on that?
I'll jump in here. It's quite a new thing, nitrous oxide, the use both in Ireland and internationally, and there's no real sense yet of what the health harms, long term are. So there is very little data. It's really only in the last 10 years that we've seen it emerge. So the data is only starting to catch up with its use.
Okay, so yeah.
I suppose one thing we do know in terms of intensive use over a period of weeks and months, certainly our colleagues who work in neurology are seeing young people present with symptoms of neuropathy. It's causing spinal damage to the spinal nerves, which is presenting with weakness and loss of sensation and so on. But that's just from a few months of use, but that would be intensive, heavy use. What the long-term impacts will be for people who maybe use occasionally over a period of many years, we certainly can't answer that as yet. It is a relatively new phenomenon, even though nitrous oxide as a substance has been around for decades. It's only been sort of widely used in this way in the last 5-6 years.
So would you be very concerned about it as a public health issue?
Yeah, I'm certainly increasingly concerned by it. The trends over the last 5 or 6 years are certainly worrying, and it's symptomatic again of a sort of a normalisation of substance use, and that's not a pattern, I suppose, for a whole range of reasons we want to see expand any further.
Okay. Just we haven't gathered national data on the extent of nitrous oxide and inhalant hospitalisations. How are we so sure that no death has occurred as a result?
Dr. Suzi Lyons from the Health Research Board. We have no data from accident and emergency hospitals, but there would be data on admissions to both hospitals, but we also have data from the psychiatric hospitals where we know in relation to inhalant use that there was 69 admissions because of inhalant use to psychiatric hospitals in 2024. We also have very good data from the National Drug Treatment Reporting System about people getting addiction treatment for both inhalant and nitrous oxide use. We have very good coverage of the addiction treatment services, of publicly funded addiction treatment services and the adolescent services. So we know that in 2024, there was 108 instances of treatment for inhalant use. Half of that was for nitrous oxide. And the number of cases for nitrous oxide has increased from 0 in 2021 up to 54 in 2024. But if you look overall, the number of cases treated in addiction services for inhalants represents less than 1% of all cases treated, which was very much in line on what we see internationally. Additionally, we have, because of the National Drug-Related Deaths Index, which is the national census on all drug-related deaths, we're very sure about the number of overall deaths due to inhalants, and that the latest figures we have between 2020 and 2022 is that there was less than 5 deaths due to inhalants, and none of that was nitrous oxide wasn't implicated in that. And going forward, what the HRB will be able to do is we'll be able to continue to monitor very clearly any increase in deaths or any change in admissions to treatment, for example.
Okay. And do you feel that the data you have is sufficient for you to direct policy direction, I suppose, or to inform policy direction? Do you have sufficient data?
So for drug-related deaths, yes, it's the NDRDI is probably one of the best systems in Europe. We rely on data from the coroner service, and it's almost a complete census. So, but that's only one part of the picture. For drug treatment data, we have very good coverage, and it's very much consistent in what we see in line with other jurisdictions. So again, we're very comfortable that we can show the numbers who are entering treatment, but of course that's many more people are using inhalants than present for treatment in the country.
Okay, I'm almost out of time.
Representative, thank you for your contribution. Senator Fitzpatrick, you're next.
Firstly, Dermot and Yvonne, thank you for being here, and my deepest sympathies to you and to Adam and Andrew, and I can't begin to imagine what you're going through. I genuinely can't, and just deepest sympathies, genuinely deepest sympathies. I hear you, we all hear you on very 3 clear requests in terms of the aerosols, the labelling, the warning, the restriction of sale, and then education and prevention, obviously. And we will, as a committee, take them up, and we don't need to wait to the end of our report. And I'm glad to hear that there's been engagement from the Minister already with you, and we will push for urgent action. It's unbelievably sad, and I'm truly, truly sorry for your loss. In terms of the HRB and the nitrous oxide, and thank you both the HSE and the HRB for coming in here today to help us with our work. Your data, and you talk about the data, shows a sharp rise in the nitrous oxide related harms. The 18 hospital presentations for neurological damage and the multiple frostbite injuries. And it's quite a steep increase in the treatment numbers, like from 28 in 2021 to 108 in 2024. They're quite stark numbers. So given these clear indicators of escalation, what additional prevention resources are needed? The HRB.
The remit of the HRB is to collect the data and provide the information. Okay. So I wonder if my colleague, Professor Smith, would be better placed to talk about the prevention strategies.
Apologies. Professor Smith.
I suppose I did outline some of the initiatives that are already occurring in terms of the area of prevention, and I guess with the issue of nitrous oxide aerosols, with newer trends, the challenge is to integrate the information regarding these newer substances into the pre-existing models, which include the SPHE in our secondary schools. As I mentioned, there are the prevention and education committees which operate under both the local and regional drug task forces, which can deliver and lead on local initiatives.
Actually, can I interrupt you for a moment? Because, to be fair to you, you do acknowledge, and you call that out in your opening statement, the fact that the drugs use, the substance use, the substance abuse has changed. The activity, let's say, in our society, in our country, has changed very dramatically, and it's all, all pervasive might be a little bit of an exaggeration, but it's certainly not confined in the way it was historically to marginalised demographics, marginalised groups, and it is a society-wide issue. So I guess my question to the HSE then is, in that context, and in the context of that the substances are ever emerging, like today we're hearing about an aerosol can, just a deodorant. We hear about fentanyl and, all of the other substances. So what are the infrastructure requirements needed, like to scale? Because we're all familiar with the pilot projects, the local drugs task forces, the youth services, the local interventions, the pilot programs. What's required to actually scale to a point whereby we have a society-wide prevention model?
I suppose that is a big question, an important question.
It's the one we're trying to answer, to be honest with you.
Yeah. I suppose, a current drug strategy in Ireland and what happens and doesn't happen is very much driven by the drug strategy, and prevention in Ireland and really across Europe seem to fall a little bit down the priority list. I think everywhere we're very focused on the harm reduction interventions for people already grappling with the most severe addictions. So my understanding of the current national drug strategy and its evolution, the new one, is that certainly the stakeholders report and the initial evaluations all seem to have highlighted a need for more attention paid to prevention. For me, there's a clearer role for more public health leadership on this. I'm conscious, I'm a child and adolescent psychiatrist. My expertise is in addiction treatment. I look forward to sort of a growing role for public health in the area of leading on prevention and bringing their expertise to this particular issue. And I guess you'd then be guided by what they think needs to be added into the equation. But I don't think it's going to be terribly different from what's currently happening.
You don't think what's going to be terribly different?
In terms of the menu of options that are there that we're drawing upon, I mean, the one that's...
Is your concern that the continuing focus will be on the the drug user, on responding to the drug user in terms of harm reduction, in terms of addiction recovery. Is that your concern, that there isn't significant enough sufficient shift towards an emphasis on prevention? Because it would strike me that the largest part of our responses has been historically on responding to the drug user, responding to trying to reduce harm, responding to trying to achieve recovery and continue beyond that. Whereas the preventative element is even in the stats. Like, we've great stats on people when they've died, but where are the stats on what people are actually using in the day-to-day? We don't have that type of data, not to the level that we should have as a society, would be my opinion. Would you?
Yep. I suppose we have the SPAD survey, we have the youth surveys have been conducted, I suppose, in about 1/3 of the counties in Ireland now, which are providing sort of real-time data in terms of what.
It's a start. I think that's excellent.
So,
but
yeah, and
to
I'm
scale
hoping.
it.
Well, I think we're all hoping that there's just an increased focus on prevention. It's moved well up the priority list.
I apologise. There's a vote in this, Janet.
Yeah, no, totally understandable. Deputy Graves.
Look, first of all, I'd like to thank Dermot and Yvonne for coming here today. I've no doubt it's very difficult, and to offer my sincere condolences to you both and to Andrew and Adam. No family should have to deal with this, not for a 14-year-old child. And what we will do is we will support you in any way we can through this committee, but also I'm the spokesperson for Sinn Féin for Drugs and Alcohol. People that I speak to, they're very aware of the nitrous oxide, they're very aware of other, but you don't hear too much about other inhalants, you know. And I definitely agree that an education programme, the one the HSE mentions, seems to have quite a number of people. Well, I'm not sure how you draw people in. You know, maybe that's something that should be rolled out through schools. But look, we can discuss that later. I'm not going to ask you any questions because you've covered everything. But definitely, I will absolutely support you with Paul on anything that we can do for you. On the HRB, you mentioned that the ease with which people can buy nitrous oxide online or through groups, and it is big business now where there's very unscrupulous people bringing it in. It's a business, it's targeted at young people, and I'd like to know how you think that we could deal with that without criminalising those that are actually using nitrous oxide.
I suppose, yes, you're correct. It's because it has its legitimate uses that makes it much more difficult to try and control as opposed to a different substance. Just looking, I suppose, further afield at the data, or the European data, it's there's very few countries have grappled with this issue. It's how to manage it or how to control it, and there aren't really any good European examples on how to reduce the sale of it. I know in Western Australia they've, I think, banned the use of larger containers of it, so at least it's, you know, it's only allowed for sale in smaller containers, so that may be one way of doing it. But as I said, looking further afield, it's proving very difficult to deal with the problem.
Okay, and thanks for that. Like, Sinn Féin brought forward a bill this week, and very disappointingly the government put in an amendment which kicks it down the line for 9 months, but it does mean it will be going to the committees in 9 months' time. So that gives us a time frame to look at what we're going to do. And it's a scourge, you know. I mean, I think we've all spoken on this. You know, not only is there a health element, there's an environmental element. You know, I came out of my house last week and there was 15 canisters on a small green space opposite the door, you know. And everywhere you go, they're there. And it's kind of acceptable, you know. And in terms of responding to, like, we need to get the message out to young people. That's the thing, you know, more than anything else. You can try and block anything you want, but there's always ways and means of getting stuff that they need. And I mean, you know, as Dermot and Yvonne have said, like a can of deodorant, you know what I mean? So basically the message we need to get across is this stuff is bad for you, rather than, you know, even dealing with the rules around them. And I'd like to know, from what you said, in terms of the education programme, reaching out to parents, like you seem to have had large numbers of people that signed up to the podcast. And if that's the case, and there obviously are people that want to know what's going on, because parents are worried, you know, they're reading these things, they're not so sure about the data, they don't know the numbers, but they know it's an issue. So how do we get that message out further and wider? Like, is it something I mentioned that can be done through the schools, through parents groups, or how do you get more people, or is there an easier way of your podcast sharing that with group of people that are interested?
So I suppose in the last couple of years there's been both podcasts and webinars, and you know, while we were delighted to see the huge interest in the event there last October, which as I said had about 1,500 people attending, you know, there's probably, I don't know, is there 2 million parents in Ireland?
That's it.
It's a drop in the ocean. So the challenge is how you build interest. And, you know, in terms of the points I suppose we touched upon, you know, and as Maguire family's experience has demonstrated, this is an issue that's relevant to every family in the country. And I think most parents don't quite see it that way. Most parents think, no, that's an issue for other kids in other areas. And it's maybe something that succeeds in causing the wider body of parents and public to go, no, this is something we all have to think about for ourselves. And it's where the actions of the Maguire family in going public, you know, really demonstrate that, without getting caught up in the very specific issue of aerosols. This is an issue that can visit any home in the country, and every parent needs to maybe be a little bit more tuned into it and to potentially consider accessing the information and advice that we give, such as it is.
Yeah, but this is a health and safety thing for our young people. It's in the main, it's young people, and I know there are some adults, but mostly it's targeted at young people for the nitrous oxide, the use of deodorant. They learn from somewhere that this works or this is a thing, you know. And any other programme that we have geared towards young people, we start with the schools. We do an education programme. We teach them from a very young age, safe cross code. How do you cross the road? So how do we get the message across to kids? Start in the schools, education programme. This is bad for you. This is the outcome. Shock treatment if it needs to be. This is what's going to happen to you if you do this. Start with the kids, and then the parents. Like most parents, if you ask them, they're going to say, "Oh, my child wouldn't do that." Not, I mean, because they don't know, you know, and these are good kids. Their kids are just experimenting with things, as everybody did. But unfortunately, what they're experimenting with is dangerous, you know, and life-threatening, and, you know, and can end in loss of life. So I think that's something that we should look at, is how you get the programme, and I think it's something the committee could look at too.
Thank you, Deputy Graves. Deputy Donnelly.
Thanks very much, Cathaoirleach. And again, both Dermot and Yvonne, it's absolutely heart-rending, and you know, obviously, we felt it over the last number of months, the grief and the pain that people experience, yourselves, your family, the community, your friends. You know, we've seen it in the park where, you know, people coming together, and I think that's been really powerful. And it's a powerful message that you both, through your own strength, are giving to other families, to give them a bit of strength to come out and say, this is an issue, this is a problem, this is something that we all have. I think one of the scariest things for parents is the fact that it is something that is in every single person's bathroom. It's in their bedrooms, it's in their homes, it's everywhere. So going along the line of prohibition is impossible, because it's a product that everybody uses every day, and it is around education and awareness and highlighting the dangers. And if you can get just to one person that maybe thinks twice before they would do it, then everything that you've done so far in your own grief will be a success. And I thank you for that. And again, it's, you know, when we talk about drug use and we talk about misuse and we talk about whether it be solvents or whether it be, you know, heroin, doesn't really matter what it is. It is something that's always going to be with us. It is a societal issue. It is something that we're never going to stop. But what we can do is to try and mitigate the damage that's been done. I think that's important of what we do here today. Just a couple of questions that I would have in relation to, I suppose, the education and awareness piece around solvents. And you've already done a huge piece in terms of highlighting that, but what it is in terms of specifics around highlighting solvent abuse, because sometimes we go to the big one, which is nitrous oxide at the moment, you know, and people are talking about nitrous oxide, but particularly around solvent abuse. The second thing I would say is there's another issue around HHC, which is obviously it's a synthetic cannabinoid that's used through vapes. There's a lot of young people. I'm involved in both the community drug team and I'm also involved in a youth initiative. And both of those were talking about the use of synthetic cannabinoids through the use of vapes, and maybe if you could talk a little bit around that. The other thing I would talk about is, and maybe if we can maybe just chat about this one, because I can tell you, going back when nitrous oxide first emerged really as a problem in the last number of years, you had the little silver bullets, tiny little bullets, and we were finding them all over the place, and we were going, what in the name of God is this? Until we found out it was nitrous oxide and it was being used and abused. And very quickly, in my opinion, and it's just my opinion, very quickly the companies who produced nitrous oxide decided that this was a really good product for us to market and market outside of where we would traditionally sell it, which is for making whipped cream and for catering purposes. And they changed their packaging to make it lovely and colourful. They changed their sales methods in that it's basically sold online, wherever you want, delivered to your door. And they changed the volume of the packaging of the canisters that's being sold. And they are huge, and we all see them. And in fact, we got a waste to energy, the waste to energy group who have the incinerator down in town. They have 3,000 of them per week into their waste energy. It's causing them huge problems because obviously they're dangerous and they're canisters. But just them alone are having 3,000 canisters. So there has to be an element of legal responsibility to people who produce this. And I have no doubts. I have no doubts when you see it across the board that they have changed the way they sell this because they are directly targeting it for abuse. And I think we have to call that one out. We have to call those people who produce this. We have to call them out as well in relation to this. But just in terms of those questions, I'd like maybe if you could answer those.
Anyone in particular, Paul?
Well, I suppose around the HAC, around the, I suppose, the education and awareness piece.
Just want to say just about the fast gas, as it's called. We've obviously looked into all this with Daniel's case and that. You were saying about the packaging, you know, lovely bright packaging, go fast or go home. That's what's written on it. You know, it's designed for kids. To go back to deodorants, we were speaking earlier. I mentioned that deodorant abuse has gone back to 40 years. We've never done anything about it. Why not? You know, that's our big question. Why not? Fast gas is at the fore now. As you said, nobody has died from fast gas yet. We are aware of young people that are now wheelchair bound because of fast gas. That information has come to us. But yeah, it's the aerosols are actually killing people. So I think that they need to be kind of segregated to a certain extent. But Yeah, no, the fast gas is a major issue. When we see it in our own community after Daniel died, we spoke to the kids. They've all been very open with us. The community have been fantastic. It's Paul's community as well. I asked the kids, where do you get the fast gas? And every answer was the same: Snapchat.
Yeah.
Every single answer was the same: Snapchat. You go on Snapchat, whoever they click a button, and that's it. They have it. It's readily available to them. You know, so.
Could I just ask, if you don't mind, just in regards to the nitrous oxide? Obviously, it's used for catering purposes, and now it's being used recreationally. Would it be possible to only order it in Ireland through invoice on say, restaurants or whatever, and ban the sale of it online to customers in general?
I mean, you're still around, so you probably want to talk to the bill the other day.
Yeah, look, I mean, again, that's primarily what we're looking to do, is to make sure that it can't be bought as it's being currently bought. It is a catering product. That's what it's designed for. So, ultimately, we have a responsibility as legislators to make sure that when we know something like this is being produced to be abused, then that, as legislators, we need to ensure that we cut off those lines of access for young people.
I suppose just our great difficulty is, that's used for catering traditionally, and now it's being used recreationally, and there is kids with major neurological problems from it and the whole lot. Just to go back to your own figures from 20 to 2022, you said there was 5 aerosol abuse cases, and none of them were linked to nitrous oxide. And this is our worry, that, people think the whole highlight is in laughing gas, and rightly so, and I do understand that. But there is control measures that you can have, like an invoiced business only being able to order them through a registered business number. Where the sale of deodorant, we're not going to stop that. And unfortunately, like Angela said in her newsletter, and Paul and Angela being extremely supportive of us in the community, aerosols are more dangerous. Deodorant is more dangerous because it can kill instantly, and there's just not enough publicity around it. And you think you're saying, Paul, 3,000 has gone to wasteland. Of those cans of deodorant, and many of them have kids used, but we don't know. Deodorant is produced for antiperspirant. Fast gas is produced for whipped cream. We all wear antidepressant. We don't all have canisters for whipped cream. So I think that can be tackled a bit more. But we've lost Daniel through a can of deodorant, and this is why we're here. We're trying to think of something that we can just, like Dermot said, education is definitely because our hands are tied and not being able to ban them. Education is definitely a thing. Like the SPH book, our younger lad is struggling through first year now without his brother. It mentions in his alcohol, cannabis and nicotine vapes. Nothing about deodorant. His brother died because he watched his brother die on his bedroom floor because of a can of Lynx, and there's nothing in it. The SPH book. So we have met the Minister for Education, and we, she'd say she would bring in stronger emphasis in training the teachers to get it more further out there. But I suppose this is our battle now, that the laughing gas is being very widely publicised without what actually killed our child.
Could just very quickly on, I know our time, just around the HHC.
HHC has been a huge concern for those of us working in adolescent addiction services nationally. It's also a big concern for mental health services. I know legislation was put in place to add it to the Misuse of Drugs Act there at the end of last August. But that seems to have resulted in a change of packaging. Been sort of brief about it, but young people accessing our services still seem to believe that they're buying HHC when they go into vape stores. It's been a request certainly that with regard to the next national drug strategy, we get much more nimble in responding to these trends ahead of time, rather than waiting for it to get as messy as the HHC situation has gotten.
Donnelly, thank you so much. Just for my own questions, and I promise I'll get there in a minute or two, but I'm just kind of sitting here, it's been probably one of the most meetings that left you most cold in terms of anything we've done in the committee so far. And just so you know, this committee was formed following the Citizens' Assembly on drug use. We are to give legislative and policy recommendations to that Citizens' Assembly. I suppose the more you pull at a particular thread, the more you realise how far behind we are. I mean, even in relation to nitrous oxide, I mean, nitrous oxide as a sale for consumption is actually banned under the Psychoactive Substances Act. It's just very rarely enforced, which leads us to just a general sense of dismay. Even when we come in to look at areas around kind of education, and everybody talks about how do we educate young people in schools. At the same time, we had the unions in before Christmas who talked to us about the very small percentage of their members who are teachers who are actually trained in this area. I suppose all of that is leading us into just a mammoth challenge, which we're really grateful for you contributing to. Even Deputy Donnelly, you'll probably have a greater memory of this than I would, but I mean, even 30 years ago in the inner city Dublin, when you'd see a parent coming into a community hall demanding responses to the sale of heroin, I never would have imagined then, you know, that you'd have a grieving family coming in with a deodorant can in your hand. I suppose it's a demonstration of how much this issue has evolved. I suppose what we're conscious of is how sometimes far behind we are in terms of keeping up with trends, and how do we get nimble, as Professor Smith says, or in that capacity. So I suppose within that, I suppose my first question to yourself, Professor Smith, is who else should be around this table? Because we're very conscious that when we're talking to yourself, and this is your third time in front of this committee actually, we're hearing about deficits in terms of, well, maybe this is for schools, and then the educators will tell us about the different problems that they would have. When it comes to prevention, you talked about an increased focus on prevention. Can you actually just, in plainly as you can, tell us what does that mean? Because I mean, we all hear, and you talked about an increased focus on prevention. Yeah. So in order for us as a committee to achieve that aim in our report in June, who else should be around the table designing or telling us where the holes are? So you're obviously here from a health-related perspective. Who should be here from education? Who should we hear from justice? Like, how do we formulate this position in as kind of holistic a manner as possible? I suppose the group who I think of maybe most to contribute, who haven't been massively involved to date, but they're getting more involved, is public health. So that they're a key group. That there isn't, you know, Professor Joe Barry, I suppose, was the public health voice that really focused on all aspects of addiction. Historically, he retired a couple of years ago. There isn't really anyone who sort of stepped in to fill that void, because the expertise of public health is about sort of preventing or curtailing the behaviours that lead to illness. Okay. And from the Health Research Board, in terms of trends that we know in relation to aerosol and nitrous oxide, I'm very conscious, even, for example, when we talked about deaths from nitrous oxide, I mean, you're using the figures from 2020 to 2022, and I understand the reasons why that is, but does that leave us too far behind? I'm also conscious when Deputy Graves talked about this being an issue mostly impacting young people, but then if I had somebody in here from the homeless services, they would talk to me about how aerosol cans are being used in home accommodation, paint stripper in some ways. Do we have the data to tell us how all impacting this issue of nitrous oxide is, or are we behind?
I think with something like nitrous oxide, we're probably catching up a little bit because it is something new. We do a lot of work in the HRB with the European Union Drugs Agency, and they harmonise a lot of drug data collection. So we, when something new comes, it can take a little while before it becomes embedded in systems. To that end, I suppose we are trying to improve our data. So, for example, we've been in contact with the health behaviour in school children, the managers of that survey, and it's the largest school survey that in Ireland. It interviews children between, about 9,000 children between the ages of 10 and 17. And the next survey, they're going to include a question on nitrous oxide for the first time. So that'll now allow us to look at it at different ages across adolescence, and help us maybe look then at risk factors. But as I said, there is always a lag between something happening and the data being available.
I suppose, Dr. Morgan, is it possible to address the lag? So say I'm very conscious that with Dermot's recommendation that we ban the sale of aerosols to under 16s, if that happens tomorrow, I'd be also very conscious of a displacement factor where young people would find something else that I'm not going to be aware of. So how do we almost live track this issue, feed it into the data? Like, even in an ideal world that possibly doesn't even exist yet. Does AI help? Does
Well, I suppose we're moving towards something like that. We're trying to develop more early warning systems because drug use has changed, and it's very much changed in the last decade with HHC, nitrous oxide, and the HRB and HSC are working towards developing early warning system to look at getting in those pieces of data before a trend becomes, before it's too late, so that we can pick up on, I suppose, signals of a new trend happening, so that we can preempt something becoming a public health issue.
And Dr. Mongan, when I asked the next question, it's absolutely no reflection of your work nor of the health research, because I'm very conscious of the amazing work you do, but I suppose I'm speaking in a how do we improve things. So when you say the HSE are looking at, can you give me the bones of what does that actually mean? Like how many people are looking at it? When should we expect?
Well, we're starting, and again, this is something we're trying to develop a system. No country in Europe has a proper system developed, so it's not like we can just take something off the shelf and do it. We're working towards developing a web-based platform. This work it's starting in 2026. It takes a long time to try and develop these things, but we do hope that this will help going forward. And we do continue with our other data collection systems. So, for example, we will have treatment, and we know there is a lag with deaths data, but it isn't as long for our other systems. Suzi, you could talk to maybe our treatment data is about.
So our drug treatment data is very good. It's the National Drug Treatment Reporting System has the capacity for to be almost real time or a month in arrears. But of course, drug treatment is further down the line, and so by the time a young person presents in drug treatment, they may have been using for quite a period of time. But it is important. It's one of the ways we can measure a proxy measure of use in the population, because we know now that from the studies that we do have, many more people are using inhalants than will turn up in drug treatment. Now, for drug-related deaths, our data is so good because we get data from closed coronial files and closed inquests, and the nature of that is that they do take some time. But in fact, we should be reporting on 23 and 24 data by the end of this year, and which is about as. Because of the nature, that would be I suppose the closest we could get for real-time data.
And my fear with that is that oftentimes aerosols, nitrous oxides, they're almost gateway to other drugs that probably treatment options are probably more available for, which is by the time we catch up with the young person who are using aerosols or nitrous oxide, sometimes they're being treated for all of the more kind of prevalent drugs that have probably more established in their lexicons. So I would like to see this committee as being somewhere who is an innovator in Europe, somewhere who is actually developing practices that may not already exist. So I'd probably, yes, sir.
Deputy, can we engage with patient service users? That's a good way of keeping up to speed with what the trends are and engaging with young people. Like we have a plethora of youth work projects. The schools, there's a lot of expertise there. So it's around sort of utilising that piece.
Yeah, absolutely. And they're the type of suggestions either now or send them into the committee. This committee wants to be ahead of the curve, I'd imagine. So even if we're imagining things that don't exist yet, please send them in, because I think resources needs to be thrown at this, because as the Maguire family is captured, young lives are being lost here. So please, let's be ambitious with our suggestions. Yes, Dr. Smith. Professor Smith, I'm sorry.
No problem. I know it's been touched on, social media is a massive complicating factor in trying to design any prevention programme. I think it's completely changed the game. Young people, were hearing about substance use by a bit of word of mouth amongst peers in localities, and you would occasionally in the past, going back 30, 40 years ago, you'd have a hotspot where there was glue sniffing in one particular area, but it wasn't spread. Whereas social media means that there's a lot of pro-drug information being churned out to huge portions of the population. And I assume there must be mechanisms whereby you can monitor that. I have no idea how you would go
potentially
about doing
turn off the algorithms, Professor Smith, would you say that?
Well, but equally then social media is potentially a tool in the armoury of prevention that maybe we need to better harness. But again, that's sort of outside my scope of expertise. but it requires people with the expertise to be brought in to guide us and to be resourced to be ahead of the curve of these trends and responding to them with correct information and so on.
Thank you, Professor Smith. Deputy Morgan, I'm sure you're going to have lots of things to say about social media algorithms.
Yes, first of all, Dermot and Yvonne, well, I can't imagine what you've been through, and obviously it's very, very brave and really, really worthwhile in the sense of just here highlighting, the issue of aerosols. And it is something I'd forgotten about. It was something that used to come up every 10 or 15 years, or you'd hear a little spike of it, whereas obviously you can trip over what used to be the silver bullets, the bigger industrial laughing gas at this point in time, and in fairness, Yvonne, you just stated out explicitly, and it's what Mark Ward's legislation was about. It's just the idea of you have registered users who have a legitimate right to make, and I would buy absolutely what Paul says, that they have produced something to sell, that it's used so kids can get high. It's as simple as that, and they make money off it. Like, you didn't need those big industrial size inhalants until the point in time that this started going through the roof. And then you have licensed users, and if you're not a licensed user, you can remove it. It's as simple as that. And I have no problem with government coming up with its own legislation, but I think the best comment that has been made is, well, we can't do this because we need more time. Say, well, what have you been doing up till now? And that's as simple as that in relation to that issue. I would agree as well, the huge issue around HHC, and you're seeing it across the board in relation to mental health issues, whether it's that now. And the chair had spoken about it in the sense of the fear of not only being flexible and able to react quick enough, making sure we have the correct information, but how do you get the message out there? Because unfortunately, the message of if you want something to get high on, it's straightforward. Social media in this day and age, absolutely you should get rid of the recommender settings are a means of how social media companies make money, and they're not particularly worried about what you're looking at as long as they're making money. Some of this stuff should not be allowed on in any way, shape or form, and I believe in the age of AI there would be a possibility for them to be a lot better. But I also accept that even before social media, people went out and sought means of getting high. And the thing I would throw out, and my fear is, when you're young, you feel you're going to live forever. And see, when you hear of a terrible scenario, that's somebody else, that won't happen to me. The law of averages, I'll be okay. Or you're just living in that minute. So how do we propose doing that? And I think Joe had it, because sometimes we all say, we need to actually talk to young people, but it's fairly obvious you need to talk to people who are at the coalface, the people who are actually dealing with this, and then those that are dealing with the worst case scenarios where it has blown up in somebody's life and they are in addiction service or through the hospitals or wherever else. But I suppose, what do we do from a point of view of catching as much of this as possible and ensuring as few people's lives are impacted detrimentally or destroyed and lost? And I'm not sure how you...
Witnesses is welcome.
Again, just to echo both my my sympathies and as Professor Smith said, the bravery of the Maguires and your family today. Thank you. It really is, I think, as Joe said, about a whole system approach. So, a health-led response should be across all sectors of society. If you think of your local authorities, you think of education, you think of sporting organisations, and actually they're those frontline feet on the ground who actually interact with young people every day, and they are seeing those trends. Often they're first to see the trends emerging rather than, if you like, the actual treatment services. So there is a piece about looking at that, and I think, as Professor Smith said, that preventative piece And I think that's what you were saying in terms of media, like that social media piece.
That's one piece, but how do we get the message out? Because I'm always afraid sometimes when something is on the news years ago, that's why people knew you could do it, and
so
literally it led to spikes.
That is a massive concern, and I suppose that's an evidence-based concern. You know, we know the evidence there in terms of, you know, actually promoting something towards young people who are naturally curious. That's their job. You know, so it is about a preventative programme that really speaks to harm and then the harm reduction around it, and really that new strategy really emphasising prevention rather than harm reduction.
Because intuitively we always believed scared straight worked, and then you found out years later whether it was avoiding it didn't.
No.
You know, because
young
the
people
human
are
brain.
risk takers. You know, that's part of their job of growing up, is to take risk and move on, isn't it? You know, detach from parents and move on. So that's a concern, and I suppose we don't have a good answer to that right now. I think that really is about all of those key stakeholders looking at this together in terms of health promotion, like the school programme you were talking about, and actually having a wider piece than maybe the drugs that we already talk about, if you like.
And then I suppose it's testing it, because that's the bit we don't do. We put a plan in place and then we defend it no matter what, as opposed to learning from what works and what doesn't by engagement. And I suppose that's the piece that the committee can do, of engaging, you know, and this is a very specific piece outside of how we deal with the overall drug problem that is absolutely destroying communities at the minute.
And it is about that wider prevention around emerging. You know, and that's what you were talking to Professor Smith in your opening statement, that today we're here about one aspect, but that actually we know that there is so much emerging at the moment, and that the strategy nearly speaks to that and being ahead of it in terms of that prevention piece.
Okay. I'm just like, but no way. No, it is that piece of what we can do. We know what we can do in relation to laughing gas. That's straightforward. As you say, even with banning aerosols, there will be something found, but we have to be able to do this better. And the traditional means of doing it haven't worked.
Professor Smith, you look like you're indicating.
I think I said this the last time I was here, but again, we should never get hopeless about our ability and our capacity to influence patterns and trends like this. And we've got to accept there's always going to be drug use, there's always going to be new issues that arrive and depart.
And also harm reduction, I suppose, if we can make it.
Yeah, but we've had huge success in certain areas in the past, but actually partly what I'd like to see more of is actually more ambition, a real declared ambition to try and reduce drug use across society, and all sort of substance use globally, and have that ambition, and then that comes from the absolute top down, and I think that would be helpful.
Thank you. Deputy Murky, your time is up. We can do a second round, so Deputy Graves, if you want to let Deputy Donnelly go forward.
Just very quickly, and it's not really questions, it's more kind of responses. So Yvonne, you mentioned, the licence and all that. That's what the Sinn Féin bill was about, really. It was to kind of use the model that you use for alcohol. You have to have a licence, you have to be over 18 to sell it, you have to be over 18 to buy it. It's simpler because it's a specific product, and you know what it is. When it comes to inhalant, it could be anything. It could be a deodorant, it could be paint stripper, it could be anything. So it makes it that little bit more difficult, but labelling works. Now you're going to have your job cut out for you to try and get companies, because we've been looking for labelling on alcohol products for export for the last number of years. And the lobby group from the vintners is very strong, and it's being pushed down the road and pushed down the road. We know it works. We've seen it work with cigarettes. It will work on alcohol. And strangely enough, a lot of the alcohol products that are being exported, particular markets, make them put on the label. So it's been done anyway. But as a government agreement, it's not agreed yet. So it's something that's ongoing. But certainly I'd push for it. It does work. But then you're looking at a whole range of products. I think ultimately it's education, it's getting in school. And I know it's all ages and I know it's all different people, but in the main, it's like the nitrous oxide, it's targeted at young people. It is targeted at young people. And also, you don't know for a child that's harmed by inhaling a deodorant or whatever else, is it their first time? Do you know what I mean? Is it something that they're in the habit of doing? Did they try it because they had somebody else in school was trying it, you know? So you don't really have that evidence because it's not like general drug use where you have all the signs and symptoms, you know? So, yeah, look, happy to support you, answer any questions that you have, and if you want to come back on the bill around, look, just contact us, but, yeah.
I suppose, you're absolutely spot on. This is the thing, like, you know, other drug use, you have paraphernalia. And like Paul said, the little silver bullets are now big canisters with colourful writing on the side, you know, all that. And it's very evident when it's being used.
Yeah.
We're in a whole minefield now, and you're absolutely right. We have a hard road to try and get the labels on it as well, you know, because like that they're imported and everything. But yeah, you've hit the nail on the head. Like it's very hard to try and regulate or notice because it's a household item.
Yeah.
You know, so I suppose that's where we're bringing it all to yourselves, see if anything can be done about it.
Can I just say also as well, the warning that's currently on aerosols such as the deodorants, the small warning, it's not very highlighted, but it is there. I believe that was actually put there voluntarily by the industry.
Okay.
You know, so they voluntarily done it. So we're going to go after the big retailers and ask them and plead with them, and we won't take no for an answer.
Okay.
You know, so.
Just a couple of quick ones. I'm around long enough to be at the beginning of the local drugs task forces back in the 90s, and I remember that all of the senior people from the different organisations, whether it be at the time it was VEC, the DTB, guards, housing managers, all of those were all mandated to be at that meeting. And the reason why there were senior people is because senior people make decisions, and that's how you then get implementation of a strategy, whatever the strategy is. The senior people at the table. I think that has massively fallen off. I think that has gone to a great extent. And I haven't been on task force in the last number of years, but you know, I think we are talking about a strategy and an implementation of a strategy. Then we need to get back to ensuring that all of the agencies who are responsible for the multifaceted approach to drug use and misuse in our communities, they have to be back at the table. They have to be mandated back at the table, and they have to be people who have senior enough to be able to be the ones that make decisions. And that's just a point I would make. The other thing I would talk about is around how we collect data and how do we respond quickly to new and emerging trends. And there are enough organisations on the ground who see emerging trends coming very quickly, but the problem is, in my opinion, and you look even at the waste energy, when they're saying there's 3,000 canisters coming in every week. So we know on the ground, we know anecdotally, we know now with concrete evidence that this is a problem, this is a huge problem. But sometimes I will find that the agencies wait for the HRB or they wait for the data to come in, and then we sit at meetings like this and we go, this is now a problem. Why? Because we have the data coming in from the HRB. But we'll have known a year beforehand, a year and a half beforehand, 2 years beforehand, that this is an emerging problem. And sometimes, again, as I say, that it's just too slow in trying to get that strategy in place and get those senior people in place to be able to deal with that particular strategy. And the last one, I suppose this is a question, is we know young people use social media to buy drugs. Does the HSE use social media to create awareness in those saying? Does it use Snapchat? Does it use TikTok? Does it use Instagram to be able to get the message out there around drug use? Or are we still with posters?
Any of our witnesses from the HSE would like to respond? Yes, please.
No, we do use social media. We work very closely with HSE communications. Our website, drugs.ie, is heavily promoted, gets a lot of visits. And then more recently, we've been holding the parents' information sessions that Bobby alluded to. I suppose also we have the wastewater initiative, where we're doing analysis of water to try and get a greater understanding of what substances are being used. So we'll continue to do what we're doing. expand as necessary, and we await the new strategy.
I have never seen on social media, never seen an awareness program. It's never come, now probably because of my age, it's not come, the algorithms are not thrown towards me, but I will have a look, I will go in and I will have a look at a HSC and look at, because I think it's very important that we have to go where they are. If they're on Snapchat, they're on TikTok and they're on Instagram, that's where we need to be.
That's a very good point, Paul. If they can buy them on it, then why are they not targeting, flashing up? Yeah.
Deputy Donnelly, thank you so much. We are actually going to, is it okay with Deputy Murky, because some of our witnesses actually have to leave. Okay. So we are actually going to finish this session. Just to say that we have got confirmation from the Minister with Responsibility for Drug Use, Jennifer Mongan O'Connor, that we will have the National Drug Strategy in the next couple of days. And I think there's an intensive job ahead for this committee in terms of scrutinising. And Professor Smith, I assure you that this committee is not despondent in terms of the task ahead of us to be innovative and ambitious, and I think motivated by the heartbreaking stories, but more to encourage our families like the Maguires. We understand the task in front of us to deliver a report that's actually commensurate with the scale of the challenge of addressing drug use, drug deaths and drug harm in this country. So thank you so much, and meeting adjourned.
Sorry, no. So there we go. That's the end of that meeting there, and we're just going to close this down. Boom. There we go. So again, a lot of waffle being talked, a lot of ignorance being seen there. Like I'll put my hand up. I didn't know a whole lot about the nitrous oxide being such a problem, some of these products that they're talking about, but I definitely was some bit ignorant to that, but certainly not the deodorants. Like that doesn't seem like something new to me. What about you out there? I see the Futures Greens asking there, did he just say the drug strategy is being released in a few days? That did sound like what he said, was the drug strategy is going to be released in a couple of days. I can rewind this here, actually, it's still open.
For drug use, Jennifer Mongan O'Connor, that we will have the National Drug Strategy in the next couple of days, and I think there's an intensive job ahead for this committee.
Boom, yeah, so that is exactly what he said there, Futures. The National Drug Strategy is going to be available to the committee in the next couple of days. So that'll be interesting. That should be the next couple of days. What day are we now? Thursday. So more than likely what he's talking about there is probably Monday, Tuesday of next week. Because if it was going to be out tomorrow, like they don't do anything on a Friday, really, do they? And they wouldn't want to release it on a Friday, let the media kind of have it for the weekend. Like they'll do it on a Monday or Tuesday, maybe on a Tuesday after something, crappy goes out there on a Monday. They'll just brush it away then on the Tuesday and back, to regular business. Then on a Wednesday, the drugs are bad and all of that stuff. Gary says, pretty sure they actually said they needed a drug strategy to discuss the strategy earlier. I might have missed that part then as well. But look, nonetheless, we're going to have a drug strategy in the next couple of days. What's that actually going to be? Somebody put it up there on X the other day. Was it Fianna Fáil's promises there before the last election? They promised to support a health-led approach when it comes to the drugs policy, but we've had nothing from them. We've had absolutely nothing. Where is it there now? I know I have it up here. Boom, here we go. But put this up on screen right now. Boom. So Fianna Fáil is committed to the idea that drug addiction should be dealt with in a humane and compassionate manner as a public health issue. Over 160 million being allocated to improve access and delivery to drug services in the community. And we've now published an interactive map of 442 publicly funded services across Ireland and are educating current services to inform future planning. And then to make all these kind of things they're going to focus in on. The second one there, decriminalise drug possession for personal use. Like zero zip absolute nada from them. Nothing. Like, seriously. Who are the members there in that committee? Because I do believe there was one Fianna Fáil member. I have them listed just down here now handily for myself. Fianna Fáil. Or no, it wasn't even it was the senator, Mary Fitzpatrick, who was just chatting there. I thought she asked some good questions there in the past, and I think she kind of questioned the current approach, the criminalisation approach, the justice approach. So she seemed like an interesting one there from the Fianna Fáil group, but other than that, nothing from them on their election promises. So no surprises there anyway, to be fair. Called it at the time when it was coming up to the election that this is only just kind of to get them some support there from the electorate. They weren't really going to do anything on it. So there you go, guys. That is the end of the joint Oireachtas committee meeting. One particular thing that Bobby Smith said inside in there is they need ambition. Ambition. Do you know what he wanted ambition from them for? To reduce drug use in society. Like, to reduce drug use? Is that really what they need to be having ambition for? Should it not be ambition to reduce the harms from drug use? Like, they see drug use of any shape and form of being harmful. Like, I wonder again, will there be a point in time in the future where they might revisit the idea of alcohol prohibition, maybe tobacco prohibition? You know, they're talking there now soon about having these online controls where you're going to need to have your ID and all of that crack verified to get online. Like, how far does it go, the control that they can have over your lives soon with all of this digital requirements? You know, how long more does cash last for? Probably quite some time, hopefully anyway. But yeah, definitely listening to that conversation there when I went off by Bobby Smith about ambition to reduce drug use. That like made me realise. Yeah, you could see a lot. I wrote my eyes on a lot. So, but stuff I already knew about these guys. Total prohibitionists, I'd say, given the opportunity, they probably would return to alcohol prohibition. If he was given enough power, probably. Futures there saying could you imagine scenes if they just dropped that out of nowhere? The amount of, yeah, exactly. Other way around, sorry. So it's like a pre-strategy meeting. The amount of messing around that could be done away with that if that one thing was brought in, decriminalising for small amounts. Man, the amount of things that would reduce, like our services here are overwhelmed. But I would love to know how much of the services are being occupied by people who are there just to satisfy court, getting caught with small amount of drugs, having to go in there saying yes or no, sir, I'm an addict, or you know, my drug use is bad, and I'm going to give it up, and I'm going to be a good boy, going to be a good girl. Whatever you identify as, and you won't see me back here again, and I'll prove it. I'm going to go to addiction counselling, therapy, whatever. Going to take a residency up in such and such a place just to satisfy the courts. A joke. So yeah, it would certainly free up a lot of services and do a lot to actually help the people who need the help. Gary saying now and again they visit they visit the port to see how they live, but other than that they have no clue. Yeah, the politicians, absolutely, they have no idea what's really going on out there. They live in a kind of different world really to the average person. I'd say even above average, like they're living completely different realm altogether. I was looking at a thing there about their pay and all of that stuff. There was over the controversy there recently about Pascal Donoghue, and geez, they get a lot of money. But your man Pascal's getting a lot of money now in the World Bank. 600 grand a year or something like that, man. Crazy, absolutely crazy. But yeah, there we go again. We should be back with future meetings from the Oireachtas committee, so do stay tuned to the YouTube. That's where we'll be going live with those videos. So catch you all again, guys. Stay blazed out there. Keep her lit. Much love.